Here I would like to take the opportunity to say a few words about the sample requirements for our workflow. Sample size often seems like the obvious limiting factor, but this example of adenomas demonstrates that it is possible to get good data out of tiny tissue pieces. In adenoma, it is very difficult to find large pieces of cancer-associated stroma. This is a case where we could only isolate that tiny little scrap you can see here on the right. We isolated this small piece from 2 consecutive sections of tissue and went on to successfully isolate enough RNA for RNA sequencing. One big question that usually comes up is that about RNA quality from FFPE tissue. This table is just to show you the quality of RNA that we routinely get when isolating cancer-associated stroma from clinical samples. On the left, you can see data for carcinomas, on the right for adenomas. For RNA from FFPE, it is best to determine RNA quality using the so-called DV200 value, which estimates what proportion of RNA is longer than 200 nucleotides. You can see in the last column of both tables that the DV200 values are usually somewhere between 65 and 80%, which is considered quite good using this Covaris-based approach. Another worry is usually sample age. There are several reports in literature that RNA quality and quantity strongly decreases with increasing sample age, and some of these reports even suggest not to use tissue older than 2 years or so. In this table, you can see in the last column that a substantial number of these samples that we used in a yet unpublished study were more than 10 years old, so more than 120 months. We could not see any problem with these samples, nor did they perform worse than the fresher samples. Thus, in our hands at least, sample age does not seem to play a major role, provided the samples have been stored under good conditions. So let me come to the end and quickly reiterate some of the important points we touched upon today. I hope I could convince you that the Covaris-based protocol for RNA extraction enables analysis of laser capture microdissected subsections of formalin-fixed paraffin-embedded tissue by RNA-Seq.